Hi, this is Dr. Eric Penniman, the Executive Medical Director for Summit Medical Group, who will be showing you today how to order advanced diagnostic imaging after January 1st of 2020. This initially will be required in Medicare patients, and starting in January 1st of 2021 will be required even to submit a claim for any diagnostic imaging. The reason for this is what's called the appropriate use criterion for advanced diagnostic imaging, which was actually a law passed by Congress in 2014. It's now law of the land, and so we need to turn this on within Allscripts. In general, this is actually a helpful tool to guide you to choosing the correct imaging and the most cost-effective imaging for the diagnostic situation you may be dealing with. Today I'm going to show you how to order an MRI of the lumbar spine using this tool, and this is in a test patient. But if you want to order an MRI, you would do it just like you would for others. And here I'm just going to use the drop-down menu underneath the flask, choose radiology. And this patient has lumbar radiculopathy, so we'll use that as the diagnosis. And then we'll choose MRI, the lumbar spine. The good news about this tool is if you're not sure whether or not contrast or no contrast is needed, this tool will actually help guide you. Then it'll take you to a screen which will ask for more historical information, and this will change whether or not this is an appropriate test. You can see that first two is a key point which correlates with the HEDIS measure, which says that we shouldn't be getting advanced imaging in patients with low back pain who have had it less than 6 weeks. In this patient, had we chosen less than 6 weeks, you immediately will see your appropriateness score down here is in the red zone at a 2. And so that tells you that there's a better test to order. Now, if your patient has metastatic breast cancer and you're worried about a tumor, it very well still may be an important exam, and so you can choose to select and then justify it and just say disagree with the appropriateness score, or better yet, choose the complex patient condition and hit accept, and then you can order it in spite of the low criterion score. In this situation, you may back off and say, let's do some physical therapy before we order the MRI, and then have them schedule a follow-up appointment with you. If the patient indeed had symptoms for greater than 6 weeks, you would choose that, and you can see the appropriateness score for that is an 8. And so you simply would hit select exam. You already have a great score. You don't need to justify anything. Hit accept, and you're back to ordering the test just as you're used to ordering within Allscripts. I think in general you'll find this helpful in those situations where you get a low score. Hopefully you find it educational and not frustrating. If you have further questions or comments, feel free to email me, Eric Penniman, or Michael Hayes from the Allscripts team. Thank you.